Hello, Victor.
Hello, everybody.
How are you?
Good.
Did
How are
you
you?
did you by chance receive the background I sent?
I'm gonna check it. When did you send me that?
Uh, I will resend it to you right now.
Okay. Mhm, 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 mhm.
Oh, it's 1 o'clock. I would say 2 minutes to allow the new other participant to join, and then we can start.
Mhm.
I think we can start.
So, as I said, hello, everyone. Thank you for joining us today. We are going to start with the introduction and open remarks of our Vice President. So, Pak, enjoy. Floor is yours.
You're
You're
muted.
Okay, sorry. Can you hear me well? Okay. Dear PSOS member and guests, welcome to the first PSOS panel discussion webinar. As a Vice President of the PSOS Initiative, I'm thrilled to have you all here. PSOS, launched by France just over 2 years ago, is a dynamic international One Health initiative. Our community has grown to over 240 members from over 80 countries, including the 26 governments and the past 215 entities, like research institutions, academia, civil society, health agency, and industry leaders. Together, we are pushing the boundary of research, advocacy, and international collaboration to combat the zoonotic diseases. One of our core missions at the PSOS is to foster dynamic exchanges among our community, provide policymakers with the cutting-edge insights, and raise awareness on the crucial issues. Today's roundtable is a step forward in our mission, focusing on the recent alarming spread of the highly pathogenic avian influenza, or recurrent AI. The rapid change in the avian influenza transmission among wild birds, mammals, domestic animals, and humans are a serious concern. Even though there not is right now avian influenza have not been the immediate global health threat, but we must stay vigilant and strategize to prevent a potential pandemic that may occur in the future. Recent developments show that the avian influenza reaching the new frontiers, emerging in Antarctica outbreaks in American cattle farms with the human cases, and also recurrent human infection in Southeast Asia and also in Africa. The virus high contagious and ability to cause species barrier threatening to our food safety, security, and the global health, and also hitting the farmers and the protein consumer hard, especially in the vulnerable communities. We must explore better prevention methods for wildlife and also the domestic animals and enhance the community engagement for effective measures. A huge thank you to our esteemed speaker from Asia, Africa, South and North America, and Europe, who will share their expertise and insights on why and how a global One Health approach is essential in combating avian influenza. Thank you to Dr. Nguyen Thi Den, Dr. Francina Forenso, Dr. Victor Naira, Dr. Spence Hammond, and Dr. Diego Del. Let's dive into this critical discussion. I now hand over to our moderators, Mariette Ducates and Fabi Cortad. I'm sorry that maybe I'm not in the correct announce of your name because we have in the different language. But this is we know that fun in the next hour we will have a lot of in the fruitful exchange and also a lot of in the fruitful discussion. Thank you.
Well, thank you very much. So it's my great pleasure to very briefly introduce two of our five speakers for today. Indeed, I'm going to start with Dr. Diego Del, who is a DVM and did his PhD at the University of Illinois in the US. So since then, you've been in the US indeed with a couple of postdoctoral trainings at USDA and again at Illinois. And now you are at Cornell University as an associate professor, and you're the director of the virology laboratory at the Animal Health Diagnostics Center College of Vet Medicine. So during the COVID pandemics, you've been very involved in COVID-19 testing, but your research focuses on vector vaccine development and on pathogenesis of quite many emerging viral pathogens, both of animals and humans. And of course, you've been very recently involved in the H5N1 cases in dairy cattle in the US. So thanks a lot for joining us. And maybe in the interest of time, I'm going to already introduce Dr. Victor Ramirez as well. So you're a DVM, also a veterinarian with a PhD as well, with a specialization in animal diseases, especially zoonotic agents, zoonotic pathogens, and viral diseases. So you're leading research projects on both diagnostics and characterization of animal diseases, contributing to the field of animal health and virology, studying major zoonotic pathogens, avian influenza being one of them. And you're really at the interface between livestock and wildlife. You're based in Chile, South America, and you also conduct investigations in Antarctica, which is quite unique. Thanks a lot for joining as well. Flavia, I'll let you introduce our three other speakers.
Thank you, Mariette. So good morning, afternoon, or evening, depending on where you are based. So I will go on with the introduction. I will introduce Dr. Nguyen Thi. She's a sociologist. She has a PhD on sociology and rural development from Liège University in Belgium. She works actually as a lecturer and researcher at the Department of Sociology, Faculty of Social Science in the Vietnam National University of Agriculture, but she's as well the co-coordinator of GREES Network, run by CIRAD, and she was a national research manager of the GCRF One Health Poultry Hub in Vietnam. She led and participated in several research projects on AMR, antibiotic usage in aquaculture, in antibiotic in supply chain, in mapping the chicken value chain and the epidemiological significance, financial relation in chicken production, gender relation in chicken value chain. And Dr. Dien has made a significant contribution to identify the socioeconomic and cultural factors affecting the disease introduction and transmission, which are the foundation for further technical research improving disease management, especially the avian influenza and other diseases in chicken. So welcome, Dr. Dien. I will then introduce Dr. Folorunso Facina. Dr. Facina is a veterinarian who did a significant work in Africa. He's DVM, and he has a PhD in molecular and clinical epidemiology from the University of Pretoria and the Utrecht University. His PhD was focused on the transboundary animal diseases, on African swine fever and H5N1 on highly pathogenic avian influenza. He previously worked at the Emergency Center for Transboundary Animal Diseases, so in FAO, as a country team leader in Kenya and Tanzania between 2016 and 2023. And now he works as an early warning and One Health intelligence expert in FAO Rome. And his areas of interest include infectious disease epidemiology, health economics, disease ecology modeling using One Health approach. And he explored One Health approach at the interface of zoonosis, antimicrobial resistance, and epidemiologic basis for transboundary animal disease. So welcome, Dr. Facina. We are very happy to have you here. And I will then introduce the last expert for today. So Dr. Aspen Hammond. So she's trained as a veterinarian in public health. She joined WHO in 2012, and she worked in WHO Global Influenza Program since 2015. Her responsibilities are focused on surveillance and risk assessment of zoonotic influenza, supporting the rapid detection and response to outbreaks and risk reduction effort of WHO and its member states. In addition, she works on assessing global influenza epidemiologic and virology surveillance data, developing guidance on influenza and other respiratory virus surveillance methods and standards, and she supports implementation of guidance and tools in WHO member states. So welcome, Dr. Aspen. So we can start, I think, with the discussion. So I will start. We'll start with basic questions that like this our audience we can shape the frame of the discussion on avian influenza, and I will start with Dr. Facina with some question about what is avian influenza, how is it transmitted.
Okay. Yeah, thank you very much. And thank you for giving me this platform and for inviting me to this meeting. Even the person that was introducing us and the panel organizers are also experts in themselves, so they can do this. So thank you for inviting us. To me, avian influenza is actually a highly contagious multisystemic viral disease, primarily affecting poultry and wild birds, or water birds. It can also affect other species like human. We've had infection in cats, in dogs, in other species outside that. And this disease manifests primarily as either low pathogenic or high pathogenic avian influenza, depending on some criteria the details of which we'll get into later. But basically, you consider the morbidity and the mortality pattern, as well as the severity of the infection. You also consider the molecular determinant of the virus that is involved in this thing. This offensive virus that causes this disease is typically an RNA virus, and it contains some protein on the surface with which they classify them into subtypes. So I would like to stop at that so that I can allow the discussion to proceed. Thank you.
Thank you, Dr. Fassina. But just to go on with your description, could you describe what is a highly pathogenic influenza?
Okay. So thank you very much. As I was saying before, I talked about those surface protein on the virus with which the virus can be classified into subtypes. Basically, the highly pathogenic avian influenza, we have some particular characteristics. Initially, I mentioned that this virus is an RNA virus. It means that it's an unstable virus. And the surface protein it carries can be from H1 to up to we've had up to, from H1 up to H16, we've had N1 up to N9. So because of the instability of this virus, it can cross any of these H can mix with any of the N. So potentially we can have 11 times 16 type of influenza viruses. But up to date, the one that have been highly pathogenic are the one that have caused, that have come from H5 and the H7 subtypes. Recently, H9 has also caused some zoonosis, but H5 and H7 basically, and this highly pathogenic virus, basically they cause significant morbidity and significant mortality. The severity of infection is also very heavy. And apart from that, in terms of molecular basis of the virus, you find out they contain the virus, we have these molecular characteristics in their molecular precursor protein of HAO. This is only determined at the molecular level. And with that particular HAO, it's consistent with all avian influenza virus subtype, the highly pathogenic one. Thank you.
Thank you very much. Maybe I can take over and ask Dr. Dill, how can we explain the highly pathogenic avian flu high contagion and its increased ability to cross-species barrier?
Good morning, good evening, good afternoon to everyone, and thank you for inviting me to participate in the webinar. So this particular virus, I think, is pretty interesting and unique in the sense that it has been circulating in North America since 2020. Late 2021 was the first detection of the specific clade 2344B that is causing the outbreak here. So it was first detected in Canada in wild birds, and soon after in the US in January of 2022. And since then, the virus actually became established in the wild bird population in North America. And I think that one of the unique features of this virus compared to, or this particular clade of virus compared to the other viruses that have been, circulating, the other H1 and H5N1s that have been circulating since 2006, is that this particular virus has the ability to cross species in a much more efficient way than the previous lineages or strains of the virus. And we don't know exactly why is that. One of the characteristics, I think, is that it really became widespread and endemic in wild bird populations. And if thinking about specifically about the North American experience and what has happened here since 2022, is that we have had thousands of detections in wild birds and several detections in poultry as well, that led to culling or mortality of over 90 million poultry, which is a huge number of animals affected. All of this poultry, or the majority of the poultry outbreaks were independent introductions from wild bird, and that's based on sequence analysis. So really, I think the widespread dissemination of the virus in wild birds and their constant contact with livestock and poultry is one of the main contributors to the size of this outbreak that we're seeing here, and I think it's probably a very similar scenario in Europe and in Asia as well.
Thank you. Can I also ask you, so earlier this year, there have been quite many cases of High Pathogenic Avian Influenza in cattle now in the US. Could you tell us a bit more about those outbreaks and tell us a bit what's different to what you've seen in the previous years?
Yes, so this is kind of a unique situation, I think. Since the beginning of the outbreak in 2022, we have seen spillover of the virus into wild mammals. So there has been close to 300 detections in wild mammals, mostly carnivores, but also marine mammals in some cases. So in those cases, the disease usually presents in those wild mammals that were affected and tested positive. Usually the disease manifested as neurological disease, and those animals were found dead. Most likely they got infected through consumption of dead bird that was infected with HPAI. In late January, early February, early March, there were descriptions of an outbreak of respiratory disease with marked drop in milk production in several dairy farms in Texas, and then soon after that in New Mexico and Kansas. These samples were sent to several labs across the country for testing, and they were tested for everything but HPAI initially, I think, because nobody would suspect that HPAI could be involved with this. And then during those episodes in dairy cattle, some of the farms were also observing mortality in birds and cats' presence in those farms. When that happened, those birds were initially obviously tested for HPAI because they were found dead in those farms, and they tested positive. The cats were also tested soon after that, and they also tested positive for HPAI. And then obviously the samples from the cattle were tested and tested positive. So it's kind of a unique situation in that the virus was detected, I think, for the first time in dairy cattle. Just before the dairy cattle detections, there was one detection in a farm in Minnesota where another ruminant species, goats, were found positive. Those goats presented neurological disease, and they were detected in a farm that had backyard poultry also affected with HPAI. The situation in dairy cattle currently, so the outbreak initiated in late January, beginning of February. The first confirmed cases were in March. March 25th, I think, is when NVSL, actually in USDA, reported the outbreaks. What we're seeing now is there's evidence of cow-to-cow transmission and spread of the virus in dairy cattle, which is concerning in that this is probably the second time that we are seeing mammal-to-mammal transmission. I think the first time was last year in Spain, where there was an outbreak in mink farms. Right now, in the dairy cattle situation in the U.S., there's 9 states that have confirmed cases, and 84 farms that were confirmed as having the virus. A lot of these farms have an epidemiological link in that animals were moved from one farm to the other. In several of those cases, and there is actually evidence for that through broad interstate movement of animals that were moved from a farm that broke a few days after the animals left, and the farm that received those animals started the outbreak a few days after those animals arrived in the new farm. So it's quite a unique situation. We don't know exactly what led to that, and I will probably stop here to give a chance for others to.
Yeah. I'll let Flavie move into a more human-related question now.
Yes, thank you very much. Very interesting. Looking at this, I mean, we know that the ability of cross transfer between species. There is question about the risk for human and the frequency of zoonotic transmission for HPAI. So, Dr. Aspen, can you tell us more about this zoonotic transmission, and how can we be concerned about HPAI becoming a global human health issue?
Sure, and thanks for having me participate. Thanks to the organizers, and pleasure to participate with these knowledgeable speakers and moderators. So yeah, at one point, I guess I wanted to follow on Fasina's explanation. In birds, it's very important to distinguish between this high path and low path avian influenza viruses. But in humans, we don't make that distinction. When humans are infected with these viruses, they can be infected with low path or high path, and the symptoms don't correspond with the pathogenicity of the virus in poultry. So I will talk about sort of avian influenza viruses in general, and to say it's already a public health issue, and it has been for a long time. For the public health, one of our biggest concern is that there could be a virus, an avian influenza virus, that changes and starts infecting humans and is capable of spreading from human to human. And in that case, it would be a virus that the human population has no immunity to, and with a change in spread, if it can go from person to person, it could affect a lot of people. And in fact, this is what leads to an influenza pandemic. And so this is our biggest concern, and why we follow these viruses in animals as well, because we need to make sure that we understand the risk and are characterizing the viruses that are circulating in animals. And we have, on the public health side, we have a strong global influenza surveillance and response network that's been around for over actually 70 years, and started, looking at viruses and how they change many years ago, and we continue to do that today. So most countries have an influenza center, and we have collaborating centers that work a lot on monitoring these viruses. So yeah, it is and has been, and I'm sure will remain a public health issue. What we look for in the viruses are particular changes that might indicate a change that would make them better adapted to mammals and transmission from mammal to mammal and human to human. In terms of the frequency of the zoonotic cases, luckily these remain rare, and every year we get cases, human infections, notified to WHO. That's part of the international health regulations, is that when these are detected, they're notified to WHO so we can monitor them and keep track of the viruses, etc. So this spillover, luckily, again, happens rarely. And in the majority of the cases, it's a spillover from an infected animal to a person, and there's not onward spread of that virus from the infected person to others. So this is very important for us to continue to monitor. So we know that thus far the evidence is that these influenza viruses remain avian influenza viruses and not adapted to humans. So, but as I said, it's really important that if there is a case, every time it should be investigated thoroughly. We make sure there's no onward spread to other contexts of the human case. And we really emphasize when there is a virus that's detected in a person, that virus is shared with our collaborating centers on influenza. So again, we can characterize the virus and be vigilant for any changes. As was mentioned, these are unstable viruses, and so again require this constant monitoring. Over.
Thank you. Thank you very much. And how will you describe the risk? Is there a trend that, I mean, when we see what's happening with more transmission in different species, and so if you had to do some risk assessment, what will be the probability that of a pandemic strain will occur in the next few years? Is there a trend, or what's your opinion?
I think it's hard to guess. I think that most people say it's not really, if, but when. And again, it just takes, one virus to emerge that is capable of transmitting from human to human. And so far, we have not seen that among the circulating avian influenza viruses. So, but just because we haven't seen it doesn't mean we can't work on being prepared, and so a lot of our work is working on the preparedness side in case that situation arises. So one of the primary areas of work that we do is, as I said, monitoring those viruses. We also select certain representative viruses that could be used if a vaccine was needed for a pandemic. Not in that case now, but we work on that because we can shorten the time between the detection of a pandemic influenza virus and the production of the vaccine. If I've already started selecting viruses as what we call candidate vaccine viruses. So a lot of our work is revolved around that. And we have to work really closely on that with our animal health colleagues to understand what's circulating in animals. And there are many activities, so that's at the global level, but there are many activities that go on at the regional level, national and local level for the preparedness. And a lot of that is making sure that there's core capacities in detecting these viruses in humans, responding to them, doing outbreak investigations, et cetera, communicating the risk to the public and at-risk groups. And so a lot of the work is ongoing on the preparedness side because we don't know where the pandemic influenza virus may emerge. So we need to make sure that all countries have these core capacities.
Thank you very much. Yes, indeed. So if we go back to what we know of the transmission and on poultry or cattle and so, and what we have seen lately with a huge number of animals that have been killed, I will go to Dr. Fadina. I will ask a question about the food safety and the food security issue about this new development of avian influenza, and as you are a One Health expert, I will as well ask you if it's going to be a food safety or food security issue, how with a One Health perspective you will do to mitigate this risk.
Thank you very much for the question, and I will take on from the question you asked us and continue. Definitely, we've talked a lot about the the reassortment that can happen in the virus. There's also the antigenic drift and antigenic shift. With antigenic drift, these are slow process and point mutation that happen over time and cause the virus to be able to evade immunity. And on the antigenic drift, this one can produce a completely new virus. And that's why she said that it's difficult to actually predict, because, you know, it's an issue of probability and likelihood, but we need to keep watching constantly. So coming back to the question on whether it can become a food safety issue, definitely both food safety and food security. And if we pick the issue of food safety first, you know, the influenza virus had not been confirmed to directly infect human by eating chicken. But the process of cooking chicken, the processing of the chicken, the slaughtering, and the processes involved along the food chain exposes people to the risk of picking up the virus. And we have had cases like in Egypt that are associated with this issue of slaughtering and processing of chicken. And so a lot of the people that were infected in Egypt in time past had been women and children, because they are the one involved in processing chicken. So definitely it's a food safety issue. When we talk about the food security aspect, definitely it can also be a food security issue. We've just heard now from the speaker from US that over 90 million chicken had been culled. This is a significant poultry population. Even if each chicken is 1.5 kilogram in meat, multiplied by 90 million, you can imagine the quantity of meat that had been wasted. I have personally been involved in a 2 million farm, and we will have to depopulate the farm. The first question we ask ourselves is, what is the impact of this culling on the country? Because this is a major farm that really drives the agenda for poultry, egg, meat, and all those things in the country. So we have to think of what is the best approach to doing this depopulation, and we have to do some negotiation and see the best way we can cull and still make sure that we retain food security. And we've had issues in time past where in parts of Africa, people had depopulated their farm, but they didn't report to the authority. They throw it in the refuse dump. And by the next morning, all the chicken had disappeared, because the people that are significantly hungry had gone into such places and say, oh, we believe if we cook this chicken well, we'll be okay. And they pick up the chicken and eat it. So it exposes them also to food safety issue, because these are animals that died of influenza. So definitely we have to be watchful. But typically normal cooking at a temperature above 70 degrees centigrade will kill the virus. And as I've said, no evidence of transmission through the consumption of meat. But the unsafe handling practices can definitely expose individuals to it. Recently, I know that the FAO, together with WHO and the partners, the quadripartite, they produced some very good guidance documents. If it's possible, I will share some of the link which you can share with your colleague. This document really gives guidance and a futuristic approach to avian influenza. If I can pick some of the points from that document, it talks about integrated avian influenza risk monitoring. That means risk monitoring that cross between public health, animal health, environmental health, because we also have environmental components. Like when you talk of wildlife, now you talk of the ecosystem, they fall largely into the environmental component. We talk about improving capacity for diagnostic in the lab capacity in terms of detection, early detection, and rapid response. We talk about establishing a One Health collaborative preparedness and differentiation and identification network, the promotion of biosecurity, especially along the poultry value chain into the livelihood system. We talk about developing guidance for HPAI vaccination, because in time past, there have been a lot of leverage towards no vaccination. But now there's a trend change, and people are now thinking of, do we adopt vaccination? So if you have to do this vaccination, how do we differentiate infected from vaccinated animal comes in? So it becomes a major issue. And so these are part of the issue that every country we need to define and design qualitatively. We think about stewardship. Even when you do the vaccination, do you have stewardship of those vaccinations in terms of reporting, in terms of differentiating disinfected from vaccinated bird, and being open with reporting? It talks about promoting One Health in the public-private health space. You know, One Health is a whole of society approach. You cannot contain it to, oh, the government must do it or the private sector must do it. Everybody has to be involved. So it's a collaborative whole of society approach that have to be included. And finally, I can also talk about support transformative research. We need to, because this virus, actually, I know that about 20 years ago, I read a paper that talked about avian influenza as a moving target. It is still a moving target till today. And so we also have to begin to think transformatively, doing transformative research that can cross all these barriers, and we can begin to break down those barriers that separates us so that we can together understand the perspective of the virus better. Over.
Thank you so much. Very clear and very complete picture. So you were talking about, yes, poultry value chain. And so I'm thinking about Southeast Asia, where we have a lot of live bird markets and so. And I will ask Dr. Zien about, so this poultry value chain need to be transformed using One Health approach to be able to better, decrease the risk, having more resilience, but as well looking at all the economic and social impact, because this poultry value chain in Southeast Asia, for example, or in other parts of the world, but Southeast Asia, it's where I know the best, are very important for the people. So how can we do that, Dr. Zien?
Thank you very much for the question, Flavie. So in my opinion, I think that HPAI is the really complex, interconnected issues. So there are some way in which the One Health approach can play a role in reducing the reach of HPAI. So first of all, for the production aspect, I think that implementing the appropriate biosecurity measures can, and also ensuring the hygiene practice across all stages of the production and along the poultry value chains could be a good way to help preventing the introduce and the spread of HPAI. The second one, I think that the good and appropriate vaccination programs can help to build the immunities against the HPAI and reduce the risk of the outbreak. The third point, it linked with the transportation trading of the poultry. So the calculate a good like measures and the method to calculate the transportation and trading of the poultry can reduce and reduce the risk of the disease and ensure the safer and sustainable practice along the value chains. Overall, the integrated disease surveillance should be a very good issues. And this is not only the action and responsibilities of one single sectors, but it is should be coordinated coordinators from different sectors, like from human health, animal health, and also environmental health. And with the integrated disease surveillance, we can have the possibility to early detect the HPAI outbreak and timely respond and prompt containment to the disease before it is spread widely. Another aspect, I also think that the poultry value chain should transform in which enhancing the knowledge and also the skill in disease prevention and control. from or by the training and capacity building for the farmer, for the vet, and other stakeholders along the value chain should be a good One Health approach to reduce the reach of HPAI. Thank you.
Thank you, Zian. And I have an additional question as you work in economics, and could you assess or estimate what has been the economic impact on avian influenza? Is it possible to assess?
Yes, no, I think that we can think to consider in several issues when we're talking about the economic impact of HPAI, and especially for in Asia. So first, we see that the HPAI will lead to the loss of the poultry population, and it is a very high mortality rate among the poultry. So it will resulting in the significant loss of the poultry population, like in the outbreak in 2003 to 2006. In the world, it's 200 million of the population was dead or killed. So that is a big economic loss. The second one, we can see that for the trading, so it because of the outbreak, so it lead to the trade restriction of the country. So it is prevent the exportations of the poultry product. So it will also link with the loss of the profits from the business actors. Also because of the outbreak, so the production costs will increase because they had to apply or implement the biosecurity measures and others disease preventing measures. So it will increase the production cost, while the price for the chicken products will be decreased because the consumers, they fears of the disease transmission, so they do not buy the chicken meat and egg anymore. So it the price will go down, or even if no one buy it. So that is also the link with the production and the price of the chicken. Another aspect, we can see that the government need to apply some like a methods or the controls or response methods. So it will increase the government expenditures or the budgets or all the resource to just control the disease happen in the country. So it will affect the economy and also the budgets of the government. So another aspect we should also consider here, that is the loss jobs of many people working along the value chain. So that is also one of the economic impact of the HPAI. Okay.
Well, thank you very much. That's really interesting, and we can understand how complex and vast this question is. Maybe we should move on now to the prevention question somehow. As most of you know, PREZODE is really an initiative that comes before an outbreak occurs, in principle, trying to really look how to prevent zoonosis. So, Dr. Nera, can I ask you, well, first of all, also we should move maybe a bit to wildlife that we've hardly touched on so far. Can I ask you what's the impact of highly pathogenic on wildlife, but also how do you think we could better prevent outbreaks in wildlife? I'm very aware that this question is quite complicated, and you may take examples, of course, in South America. Yeah, thank you.
Yeah, hello everybody. Thanks for the invitation. So first I would like to explain a little bit how the virus hit the South America. We never had this virus before 2022. The virus was first detected in Colombia in November and wildlife, and then in October 2022, 2022, then in November in Peru, Ecuador, and other countries, then in December in Chile. So the virus came from North America based on our phylogenetic analysis. And we estimated that came from different introductions, but one of them, the Peruvian and Chilean cluster, spread to other countries such as Bolivia, Argentina, Uruguay, and Brazil. So we had this situation where we never had this virus, the population were naive, and then we started to see massive mortality events on the seabirds population as well as in marine mammals. I'm going to explain a little bit about the situation that we observed in Chile. More than 10,000 animals, dead animals, were recorded in the Chilean coast. Most of them were avian, but about 26,000 South American sea lions were observed in the Chilean coast. So that's a massive mortality event. We detected about 60 different species positive to this virus. Most of them were avian, but also we observed marine mammals, such as I mentioned it before, the South American sea lion, but also we had some detections in cetaceans, such as whales. So the virus had this tremendously impact to infect different species. Also, we have some cases, for example, in iconic species, we have this Humboldt penguin that is a species that is near to extinction. So for that case, we observe about 3,400 dead animals, which represent about the 30% of its population. So we had a very, very severe outbreak here in South America. The same happening in the rest of the countries, such as Argentina, Uruguay, and Brazil. So how to prevent the dissemination in these wildlife populations? In my opinion, it's very hard to try to perform direct actions on the wildlife. However, we have some examples in animals that, for example, is facing extinction. In May 2023, the USDA, for example, approved the MRG vaccination in the California condors, which is an iconic species the United States that is near to extinction. So in some special situation, we can try that. But in the rest of the cases, I think the best way to prevent outbreak in the wildlife is try to eradicate the virus in the poultry side. The poultry also is an important source of the virus to the wildlife. So we have to enhance the biosecurity measures in the poultry farm, try to eradicate the virus, increase the surveillance and monitoring regarding to try to avoid this virus to prevent also in the wildlife.
Thank you very much. That's great to have both the South American update, but also a perspective on the biodiversity and conservation questions that are really very important here as well. So I understand prevention of outbreaks in wild birds, wildlife in general, is really hard. Would you have some insights on the prevention of the spread, the transmission of highly pathogenic avian influenza among all the different categories, somehow domestic birds, livestock, wildlife, but also human, if you can?
Yeah, I think it's again. I think the transmission chains of these high path viruses usually come and go between the wildlife and poultry, but sometimes goes to humans. So because it's very hard to prevent the cases in wildlife, we have to try to controlling or put the efforts in the poultry. and now in the cattle, I think Diego told about that case also. So basically, it's involving implementing the biosecurity measure, encourage the early reporting and detection in the both industrial farming, but especially in the backyard poultry populations. I think the education is the most important to let know the people that the risk of the influenza virus, so they can report early, and in that way they can also prevent.
Right. Thank you very much. That's very informative. Flavie?
Yes, thank you. Can I ask you the same question? I mean, more or less the same question, Dr. Haspen. So from your point of view, as working at WHO, what will be, I mean, completing what Victor said, measure for preventing public health sectors, or some alternative that could be developed?
Sure, yeah. Sorry, for me? Yep. Yeah, in humans, again, as I said, thus far, most the cases that we see in humans are a result of exposure, directly to an infected animal, or sort of indirectly through exposure to an environment that might be contaminated with the virus, through droppings, etc., from birds. And so for people, we want to reduce this risk of exposure. So that means, protecting people from infected animals and their environments. So, I guess to governments, we suggest, looking at a risk, sort of a risk assessment to see, who are the populations that are at risk, and how can, the most appropriate measures be targeted to different groups. We know that, there's the public, but we also have people who work around infected poultry or infected mammals now. For the public, we recommend, obviously avoiding contact with animals that are sick or dead from unknown causes, including wild animals. And as was mentioned, reporting this to the appropriate veterinary, health authorities, so that they can be the ones who can manage the situation best. And for food safety, as was mentioned, properly preparing and cooking food can really decrease the risk. So emphasizing the importance of good food safety practices, and now we have to emphasize that means consuming or avoiding consuming raw or unpasteurized milk, and not just for avian influenza, but for other pathogens. Only slaughtering healthy animals for consumption, avoiding consuming animals that have gotten sick or died from unknown reasons. And for humans, we really want to encourage anybody who thinks they may have been exposed and are feeling unwell to obviously seek healthcare quickly, so that they can get the appropriate clinical management they need, and be tested. And if the the clinician feels that that's needed, and can be diagnosed, so that we can understand what's going on. If somebody's sick, obviously wearing a mask, washing your hands, after you've sought healthcare, and in those circumstances, if there's a human that's infected, we really want to understand if that person can transmit to other people. And so that's, again, where the investigations come in to try to understand, the contacts and follow the contacts, etc. There are people who are at risk because of their occupation. So there's a lot of guidance on, being provided with the appropriate personal protective equipment, being trained and putting that on and taking it off. It can be a burden working, I think, in areas where it's hot and it's not easy. But that's one of the best ways we have to prevent the exposure of people who may be in contact with infected animals through their occupations. I mean, I think a lot of the public health measures for prevention have been around for a long time. As was mentioned, the virus has been circulating for around 20 years or more. So, and causing human infections for that period. So, there's a lot of practices that have been discussed on the animal side and the public health side. But again, for the public health, it's really practicing good food safety. Washing hands, if I didn't say that already. Seeking healthcare, getting the appropriate clinical management, and for the authorities to investigate and ensure that there's no further spread from an infected person to another. So stop there. And sorry, maybe one last point, because we're talking about One Health, I just wanted to say that, it's really important when we're talking about these preventative measures, that all of this work is done collaboratively with the animal health side and the environment side, so that the preventive measures, the risk communication that goes out is made with a sort of one voice coming from all these partners who are working in this area, so that there are consistent messages. So that we can increase the trust in public health and animal health, and be able to respond quickly and effectively when there's an emergency. Thanks.
Thanks very much, Aspen, for the very comprehensive answer and making sure we make the distinction indeed between exposed individual, general public, if we want, and all this in the One Health context. That's really nice. Can we open the question maybe to all of you? Well, Victor already told us quite a bit which prevention measures he was thinking of, especially for wildlife, but also domestic poultry to some extent. So we've mentioned vaccination, biosecurity, but maybe Diego, Festina, Diane, would you say there are other measures of preventions that are in place for the livestock management, maybe more specifically in different parts of the world that we've not touched on? Or also, if you have ideas of alternatives that could be developed, could you elaborate a bit on this point?
Okay. Yeah, if I'm given the floor, I can make an attempt, because based on the field experience I've seen, issue of stigmatization also affects avian influenza. I've seen community where it was difficult to report, because once a farmer reports, the whole community stigmatized that person, because the authority comes in, they just kill they stamp out all the chicken in the community, and then everybody zoom in on the household that reports as the one that is promoting the loss of their livelihood. So that has to come in. So in that way, we have to think of integrating and intensifying effort on behavioral science and adult learning, including sociology, social psychology, all these things that can aid in promoting avian influenza. We shouldn't see it as a biological science field alone or medical science field alone. We need to look at it elaborately. So that is important. We also need to think of building community trust if we want to prevent avian influenza. If you don't get the community to even trust the authority, it's difficult. I've been in a situation, because I've had a lot of field experience, wherein farmers were not reporting to the authority, and we asked them, why are they not reporting? They said in their community, one, it's a taboo to bury animal where human beings are buried. And this is what the veterinary authority is doing. So because of that, they cut off all form of reporting to the veterinary authority. So this you need to look at the local context where you are dealing to be able to make an impact. So building community trust and engaging the local community in terms of building the team that will do this rapid risk assessment and reporting is important. It's also good to share experience. If a community or a country had experience, you can share that experience across the sub-region without being stigmatized, so that others can learn from you the successful measures, the success story you have in your own implementation approach. You should be willing to share it. We should also make sure that we have this local emergency response team in place. You don't begin to quench the fire after the fire is already burning. If we have this local authority in places that are able to immediately act before they even report to the national authority, you will find out the critical response time will be faster, and then it will reduce the scale of outbreak and possibly a human infection. And so we also need to create these regional and sub-regional networks so that lesson can be learned across country, because one of the other things I've seen is the centripetal spread of influenza. Once you see it happening in a locality, it continues to spread out centripetally. And why? Because the price of chicken and egg in that community that is infected goes to zero. And in the neighboring community, the price begins to go up. So people feel their animals were not infected, move their chicken overnight to this non-infected community, and they keep spreading out the infection. So if there's this regional collaboration and everybody are contributors to that regional collaboration, it should also assist in avian influenza. These are based on my field experience. Thank you. Over.
Yeah, thank you very much. That's a great insight. Diego, did you want to add?
Yeah, maybe I can talk a little bit about what is done here in the US in terms of prevention. And I think the situation is evolving now because we have more than one species, livestock species affected. But in poultry, basically the measure of prevention or control of the disease is there's no prevention measure that is used other than increased biosecurity in poultry farms. There's no vaccines that are used in poultry in the US. They're not licensed, they're not allowed. So the measure of control is depopulation of affected farms. So all the animals that, an affected farm will have to be culled. And that's what added up to the 90 million birds that were, affected here with the outbreak since 2022. So that's the measure of control of the disease in poultry. In dairy cattle, the disease is not leading to significant mortality in animals. There are reports of some of the affected animals dying, but it's not a large number of animals that dies in those affected farms. So the control right now is quarantine of movement. So farms that are testing positive for dairy farms that are testing positive for HPAI, they cannot move animals out of the farm for at least 30 days post testing. So that's the measure that is being used now. I do think that it's probably about time that we start thinking about rational use of vaccination for prevention of the disease. While the cooling strategy may prevent the virus from becoming endemic in poultry, and I think it was effective here in the US in poultry. With the new situation in dairy cattle, where there is animal to animal transmission, and cooling is not really a reasonable approach, I think, in my mind. We and the US government will have to start thinking about using vaccination as a way of preventing the disease. I think that's an important thing that will have to happen, and I think they are thinking about it. And at least vaccination in dairy cattle, I think there's work being done on that, and there are companies that are looking into the efficacy of their vaccines for use in dairy cattle.
Yeah, thanks a lot. That's a very interesting point, and maybe I can make a link with the situation in Europe, where vaccination of poultry has had been almost like a taboo, also for trade reasons. No one was allowed to vaccinate birds against avian influenza, but since autumn 2023, we are allowed, and France has started vaccinating ducks the last winter. So I think mentalities are definitely changing, and also simply the society is not happy anymore with culling of millions of birds. So not to mention what would happen if that were the strategy for dairy cattle, obviously. But that's an interesting change of perspective at an international level.
And I think, you know, with the vaccine platforms and technologies that we have right now, I mean, one of the main issues is the fact that the virus changes and then soon the vaccine is not effective anymore, right? But with the current vaccine platforms that we have on hand, it would be relatively easy to update the vaccines and then, you know, deploy those updated vaccines when the virus changes. So I think that's, you know, a consideration that also needs to be that also needs to be considered.
Yeah, I agree, and I think the One Health perspective can also definitely help here. While WHO updates seasonal flu vaccines for humans twice a year, veterinary vaccines in general are much more rarely updated, but we could help one another there too, so that we have efficient vaccines for avian flu as well. Maybe, Diane, did you want to add something on the Asian perspective for this prevention question?
Yes, I just want to add some point for the situation in Vietnam, for example. So you can see that as a country in Southeast Asia, and we face like a very critical weather and climate fragile and changing the weather very quickly. So that is an effect to the poultry health. So in Vietnam, we have a very diverse production system. So in, for example, in the big poultry farm, the vaccination program, like our colleague already mentioned, is pay very special attention. But in some other areas, still farmer practice a very small scale of production and open housing system. So of course, they apply vaccine to the chicken or the poultry in general, but also they combine different type of the poultry, chicken, and even with pig or aquaculture. So that is a very complex production system. I mean that besides the vaccination implementation, it's also still have some other measure linked with the biosecurities, and there is a different perspective in practicing biosecurities on poultry farm. For example, from the company farm, the closing system is considered that is good for the monitoring the weather, the waters, the feed, everything. But another way, the open farm, they say that let the chickens find the food by themselves, mix food, and let the chicken like adapt step by step with the weather. So that is also the good biosecurity measure. So I think that is here when we're talking about the measure to prevent the HPAI, we should think about how can I say the like the combination of the scientific way and also the local knowledge and the traditional way to apply the preventing method. Yeah.
Thank you very much. Yeah, that makes total sense. I think it has come back a couple of times, this importance of dealing with the local situation, taking the local situation into account so that the actions are more meaningful. Thanks. Maybe now we can open the discussion a bit to a much wider sense somehow, with really the One Health approach in the center. Can I ask you, Diego, maybe again, if you could give us some insights on how One Health approaches you think are going to help and lead to more effective strategies integrating animal, human, environmental health, and so that we can have quicker and more efficient responses to outbreaks or to prevent them?
No, I think it's the One Health approach. It's probably the best case, the best scenario for One Health approach is influenza virus and the influenza outbreaks. You know, for for all the reasons that we all discussed here this morning, is a virus that, you know, it's infecting and circulating in wildlife. It affects livestock, causes, threatens, you know, food security, and also public health because it's a zoonotic agent. So I think it's really critical that we look at this with a One Health perspective, and that it is tackled using a One Health approach. It's not an easy task because it will require buy-in of every country across the globe and all the agencies and you know, government agencies of every country to really tackle this because of the fact that it is a global disease right now. I think that complicates the situation significantly when thinking about a disease that is localized in certain areas. So I do think that, you know, organizations like WHO and FAO would have to probably take the lead of trying to organize this global One Health network to tackle avian influenza. And this would require a huge amount of investment from governments from every country affected to really bring the teams together to work in trying to establish effective networks. I think number one would be testing, right? I think early detection is very important for controlling and preventing any disease. And I think that for influenza is not different. So I think that would be probably the first thing that would have to be established. There are countries like the US that have a good network of testing labs that could do testing and are already doing testing and have been doing testing for influenza in several species, including humans and swine and wildlife. But I don't think it's enough. I think that there needs to be more investment in that to do broader testing and additional testing here and in other countries as well. That would be the first step. And then I think that a global approach to developing prevention strategies and investment in vaccines that could be used broadly. I think that's another important component. And obviously the environment. I think you know, the virus is in the environment, and in some of these situations lead to significant environmental contamination, and not just the contamination aspect of it, but the role of the environment in enabling the spillover. I think there's a lot to it that influenza is kind of the classic example where contact with wildlife and you know, expansion of human populations into wild in forests and areas like that, and increases the chance of exposure. So it is a disease that really requires a One Health approach at the global level.
Thanks a lot. Yeah. Victor, can I ask you a bit, well, almost the same question, I would say, if you have some more insights, and maybe if you can add something more specific with how do you implement this in regions with limited resources and high biodiversity, as you've touched on quite a bit on wildlife?
Mm-hmm.
Thanks.
Well, I believe the One Health concept is well known between veterinarians, but probably is not a concept well known in in all the people in the community. So if we are able to educate the people about the concept of the One Health, about the importance of the zoonotic risks of the influenza and other viruses, we have a good opportunity to get early detection, early report. So I put a lot of effort to educate the people here. You have this massive outbreak in the middle of the summer when the people went to the shore in holidays, and then the government put a lot of effort into the campaigns by digital media, radio station, television, to let know the people that there is a zoonotic risk. Don't approach to the animals. I think that is a best way to start, especially in places with non-development countries, for example. And also this concept of One Health should be also well known between the public health, because also the human doctors, sometimes they don't manage or they don't know well the concept. So I say that we need to educate also the public services about the zoonotic risks. So in addition, especially in countries with less resources, I believe that the human part usually had more tools, more diagnostic tools that could help to the animal side. I mean, the machine, PCR machine, the technology to detect. So also, I think we have to work together with the public health to improve the diagnostic and the early detection.
Yes, thank you, Victor, for these comments. And in fact, so I agree totally with you about this aspect of engaging community and education. But what we know is that, and I will talk about the field expertise as well, that changing process is complicated and require as well other perspective on social and behavior management. And I will ask this question, the last question to the end about that. So what, in this One Health approach, what community engagements or behavior change strategy can we support and implement to fight the next potential pandemic?
Yes, I think that there are some way in which the community engagement and behavior change can the strategy can help to reduce the spread of the HPAI. First, I think that so that strategy can help to raising awareness about the reach of HPAI. And the transmission pathways preventive methods or measures. So the individuals and the community can make a good decision to protect themselves and protect their poultry. So I think the first one like that. The second one is also have to promote the behavior change, especially to adopt a good preventive practice and also proper hygiene measure and biosecurity measure, so that the reach of HPAI transmission can be reduced. And you can see that once they understand and they have some change in their behaviors, so they can another aspect that is the coordinate or the collaboration or building the trust. It's not only with the government but also other stakeholders linked with the poultry business. So this collaboration can ensure the appropriate interventions that suitable to the local context, suitable to the cultural and economic context of the communities. So that is also, and also it address well the community need. So that is becomes more effective. So and by all of that, so the community engagement strategy help also empower the communities in the way that they can like have some like well participate in the surveillance, in reporting the sign or the symptoms of the disease, and they can also initiate the good responsive activities. So it's contribute more to the One Health approach. And I already mentioned earlier about the local knowledge and the good practice in the communities. So by engage well with the communities, we can combine the scientific knowledge and the local knowledge, and also the resource in designing and implementing the HPAI prevention strategy. So in overall, I think that the community's engagement and the behavior changing strategy could help to reduce the spread of the HPAI. Yeah, thanks.
Thanks a lot, Diane. Maybe as we are doing pretty well time-wise, I can ask Aspen, would you mind responding very briefly to Diego's call on the role of WHO for coordinating One Health efforts? Thanks.
Yeah, thanks. Yeah, just some points to mention based on our experience, and I think that working in the One Health is not easy. It's a great concept, but putting into practice is not always easy. There's a lot of barriers, there's trade, there's data confidentiality, there's a lot of issues. From our side, we do work very closely with the FAO and the World Organization for Animal Health at the global level. We what I think is important is to, before an emergency happens, to get familiar with each other and share information. And so we do that at the global level routinely. We have a monthly call on influenza, and we share what each organization is doing and information. So I think before something happens, it's good to have a network set up, and if something happens, having a joint investigation. So if there's an investigation that's needed, making sure that public health is there and animal health and environment, that everybody is part of the investigation team is very important. And from our side, we do a lot of trainings in regions and countries, and we have public health and animal health come together to work on the preparedness and response actions, so that they can get to know each other and how the different sides work before an event happens where the response is needed. And I think obviously, as the risk communication part, I think is very important, as I said, to have messages aligned so that there's no conflicting messages to the public that are going out. Yeah, I'll stop there. Thanks.
Well, thanks a lot. If I may, maybe I can just mention that we're quite lucky with flu, as some of you already mentioned, as it's a very good example to implement One Health questions, and that we have the off flu as well. That's putting WHO, FAO, and WOHA together to also try to move on and reach results towards solving One Health issues for influenza. Yeah, and maybe, unfortunately, we cannot take all the questions, but the ones that were in the chat have been answered, if I'm correct. Maybe Farron Jory, you have a hand if you want to ask your question. We would just have time for one burning question. Or maybe that was a mistake, the hand raised, I don't know. Yes, Farron? Well, sorry, I can see that your mic is on and off, so maybe that's a connection problem. Else you can just write it in the chat if.
Right.
Thanks, and maybe, well, if you want to try one last time, and then we'll wrap up.
Or maybe you can write the question in the chat. So like this, we can have
Yeah,
some
that would be ideal.
I think there is also a question in the chat, now that I was asked.
Yeah, maybe I can read it. What could be the best One Health approach method to curb the spread of avian influenza in developing countries?
And
I think
Fassina is going to answer if I'm done.
I was actually typing some responses to that. One, as you said, in terms of the best approach, you know, One Health is a collaborative approach in the first instance. Apart from the official engagement of the Ministry of Health, Ministry of Livestock, Ministry of Environment, you also need to engage the community, build trust with them, co-create developing platform. They have local reporting platform, which you can help co-create with them. They help them to do rumor tracking, create openness among them, and promote trust building among the local community. So this will make them to report whatever they see locally immediately to either the public health or animal health authority, or at best to their local chiefs. And from there, this information will scale up consistently until it gets to the national level. And in terms of response should also be rapid. And then building a two-way communication is very important. You know, in most cases, we scientists, we go to the community, we deal with them, we collect information and all those things, but we never give them feedback. The community don't like this. They know they cannot fight you as an authority, but it diminishes your trust level the next time you come to the same community. So providing feedback on whatever information you collect from them is necessary. With this, you'll be able to gain their trust. And when you co-create ideas, you also make it look as if it is their own. They own it, and whatever they own, they are ready to drive the process. That would be my response. Over.
Well, thanks a lot. I think, well, Flavie and I, we are going to thank you 5 great panelists for this very, very interesting discussion. And we'll give the floor to Elsa for a wrap-up of the seminar.
Yes, thank you very much. It was very interesting, yes, for all of us. Thank you so much.
Thank you so much to all of you. Thank you, Mariette. Thank you, Flavie, for this great moderation of this this webinar and this panel discussion. Thank you so much to our 5 outstanding speakers. It was such an interesting discussion and such great information to have. So thank you very much again to all of you. I think this panel discussion really emphasized how important is it to adopt a One Health approach to tackle the issue of highly pathogenic avian influenza. I think prevention here is the key, and it's at the heart of PREZODE initiative, preventing zoonotic disease emergence, and not only avian influenza, but for all other potential zoonotic disease. Obviously, PREZODE will closely look at the avian influenza developments worldwide, and all its members will be motivated to address the issue. So thank you again to all the participants. Thank you for attending this webinar today, and thank you again to all the panelists for your great input on this topic. And stay tuned for the next PREZODE webinar, will hopefully happen soon. Thank you again.
Okay.
Thank you very much.
Bye.
Thanks, everyone.
Thank you.
Bye-bye.
Bye.
Thanks.
Bye-bye.